Good day! We are pleased to present a research study entitled Knowledge, Attitudes, and Practices of Dengue Prevention Guidelines among Chosen PUROK in Bacolod City. Our group consists of yours truly, Rozennie Zane TAMETA, together with Joefe TORCITA, Veronica Villarete, and Hilary Gwyneth VILLAGRACIA. Dengue is an increasing global health threat driven by urbanization, climate change, and international travel. The Philippines reported a 68% increase in dengue cases in 2023, signaling a worsening outbreak. A study in San Fernando, Pampanga examined public school teachers' knowledge, attitudes, and practices regarding dengue. Most teachers were knowledgeable about symptoms, transmission, and prevention thanks to health education initiatives. However, some misconceptions remained, including the false belief that dengue can be spread through blood transfusion. Awareness of dengue vaccination was low, influenced by vaccine hesitancy linked to DENGUE controversy. Teachers showed positive attitudes and engaged in preventive behaviors such as maintaining cleanliness and removing mosquito breeding sites. The study highlighted the need for stronger public health campaigns and community engagement, especially to address misinformation and improve vaccine confidence. For the objective, this study aimed to determine the level of knowledge, attitudes, and practices in dengue prevention guidelines among residents of Chosen PUROK in Bacolod City.
For our methodology, we used descriptive quantitative correlational design to analyze numerical data. A total of 220 residents aged 19 and above from selected PUROK in Bacolod City were selected through simple random sampling with a sample size determined using Cochrane's formula, 0.05 margin of error, and 95% confidence level. Non-resident and individuals under the age of 19 were excluded. Data was collected using a modified survey questionnaire designed to assess knowledge, practices, and attitudes related to dengue.
Now, let's move on to the results and discussion. For the demographic profile, the study on the demographic profile of the 220 participants in Bacolod City reveals key factors that affect dengue prevention efforts. The majority of participants are young to middle-aged adults, predominantly female with low socioeconomic status and limited educational attainment. Most only completed high school and 95% fall within the low-income category. This characteristics indicates potential barriers to health education and access to resources. Women who play crucial roles in household health management represent a significant opportunity for mobilizing dengue prevention efforts. Public health interventions must be tailored to this community by using accessible visual communication and leveraging women as health advocates to overcome the challenges posed by low education and income levels. Among 220 participants in Bacolod City, most are young female and from low-income households. Despite limited education, knowledge of dengue prevention is high across all education levels. Both low and middle-income groups showed similar knowledge scores, suggesting that inclusive, community-based health education is effective. These results highlight the need for culturally appropriate messaging and empowering local women on health leaders. The study shows that most residents exhibit very high attitudes toward dengue prevention. Older adults and those with lower income and education levels showed slightly higher attitudes. Female and married or widowed participants also had stronger attitudes. These findings support the health promotion and behavioral systems models, highlighting the role of personal beliefs and stable behavioral patterns in health practices. The results align with previous studies emphasizing the need to tailor public health messages based on demographics. High knowledge levels also suggest that awareness of dengue's seriousness drives preventive actions. The study reveals that residents generally exhibit high levels of dengue prevention practices. Older adults show the highest levels, followed by young and middle-aged adults, all demonstrating high engagement. Education and marital status did not significantly affect practice levels. All groups reported high adherence. Similarly, both male and female participants, along with low and middle-income individuals, showed strong practices, with middle-income participants having slightly higher levels. These findings align with the health promotion and behavioral systems models, suggesting that self-efficacy, the perception of benefits, and stable behavioral patterns drive consistent dengue prevention practices. The results also align with the global studies showing that age, education, and risk perception influence adherence to dengue prevention guidelines. The study found no significant differences in the level of knowledge in dengue prevention based on sex, age, educational attainment, marital status, or socioeconomic status, indicating that residents have similar high levels of knowledge regardless of these factors. Additionally, there were moderate positive correlations between knowledge and attitude, and stronger correlations between knowledge and practice. Strongest correlation was between attitude and practices, suggesting that individuals with more positive attitudes are more likely to engage in dengue prevention practices. These findings emphasize the importance of knowledge in shaping attitudes and practices towards dengue prevention, supporting the idea that targeted educational enhances preventive behaviors. The study found no significant differences in attitudes toward dengue prevention based on sex, socioeconomic status, or educational attainment. However, significant differences were observed based on age and marital status. Older adults exhibit more favorable attitudes than young adults, and widowed participants had better attitudes compared to singles. These findings suggest that older and widowed individuals may have more proactive attitudes toward dengue prevention, likely due to personal health experiences. This is consistent with previous research which indicates that age and life experiences can influence health attitudes. The study found no significant differences in dengue prevention practices based on sex, socioeconomic status, or marital status. However, there was a significant differences based on educational attainment, with college-educated participants exhibiting better practices than those with only a high school education. These findings suggest that higher education enhances individuals' ability to adhere to dengue prevention guidelines. This aligns with Nola Pender's health promotion model, which emphasizes that education boosts self-efficacy in health behaviors, and Dorothy Johnson's behavioral system model, which highlights the importance of well-developed knowledge for effective preventive actions. Previous studies also support this, indicating that higher education is linked to better dengue prevention practices. The study found significant positive correlations between knowledge, attitude, and practice regarding dengue prevention guidelines. Higher knowledge was associated with more favorable attitudes and better practices. Additionally, a stronger attitude was linked to better practices. These results suggest that higher knowledge and positive attitudes are key drivers of effective dengue prevention practices. The findings align with Dorothy Johnson's behavioral system model and Nola Pender's health promotion model, which emphasize the importance of knowledge and attitude in influencing health behaviors. Previous studies also support that a positive attitude and good knowledge increase the likelihood of practicing dengue. This study explored dengue prevention knowledge, attitudes, and practices among residents of chosen PUROK in Bacolod City. It found that older adults, females, and individuals with higher education and income had more favorable COP outcomes. Overall, residents showed high knowledge, very high attitudes, and high preventive practices. A strong positive correlation between knowledge, attitude, and practice suggests that better knowledge and attitudes lead to more effective dengue prevention practices. These findings support Pender's health promotion model and Johnson's behavioral system model, highlighting the importance of self-efficacy and routine behaviors in health promotion.
The study found that residents of a selected PUROK in Bacolod City exhibited strong knowledge and practices in preventing dengue. Positive attitudes were found to enhance preventive behaviors. Additionally, cultural values like bayanihan significantly support and strengthen community health initiatives. To improve dengue prevention, the study suggests encouraging positive attitudes in the community and using local dialects and trusted leaders to deliver health messages. Nurses should be empowered as health educators, and nursing education must be strengthened to support this role. It is also important to provide consistent resources and continue research to improve and sustain health programs.